move on through their training.
How much blood do you think collected up in here, and then while you're putting pressure, squeezed out of it? A lot, right? You think that's enough to kill this guy? Enough blood loss to kill this guy? Yeah.
I didn't know they were going to bleed that much. What was really hard about it was actually putting the amount of pressure to stop the bleeding. So assessing bleeding control is super important.
I think the big thing was communication, right? Yeah. When you guys first came in, you were both working on the same injury at the same time, right? There's multiple medics, so you can work on multiple injuries, right? Yeah. Just communicate, make sure you're on the same page, make sure you're doing multiple things.
Teamwork is extremely important. It's important to stay calm and be able to communicate what you need done for the patient with your partner to make sure that everybody's on the same page and everybody's sticking to life-saving measures that need to be taken.
They're taught in the whiskey portion of the program to treat patients as one person, and we teach them here in the aid station. It's not just one person, it's a team effort where you're treating one injury and I'll treat the other injury, or you're getting vital signs and I'm giving an IV.
Go for it. We got the patient. We got to start wrapping that axillary with. Go!
The third block of the field training exercise is the prolonged casualty care lane, where students perform more advanced procedures and have to care for patients for an extended period of time.
Is this bag with the Y tubing for blood getting ready for blood?
Instead of having medical evacuation assets available to you in the next hour or 2 hours, we want them to start thinking, I've done this, and then what? So if evacuation is delayed for 1 hour or 2 hours or a day or 2 days, it's asking what else can I do for this patient?
I don't have rise and fall from this side of the chest.
Okay,
So
give it a minute. This isn't going to be simultaneous. We're not going to seal it and then he's going to start breathing again.
We have a patient that is brought in from patrol. They may or may not have all their injuries substantially taken care of, so therefore they're brought to us. We have to package them, get any life-saving interventions going through a specific algorithm. We're doing it under a high-stress environment, low light, simulating an area that is far away from home. Supplies may be limited, manpower may be limited, and you have to do everything you can and meet your evac time.
So, 140, blood pressure 140 over 70.
High-fidelity mannequins are again used, and they offer real-time feedback on their vital signs.
Are his eyes moving? Is he responding to light?
Yeah, they're dilute, or
Is he responding to light, yes or no?
You have someone that's on the head that's usually your lead person. They are the one calling the shots, calling the movements, repeating back what they need, if they need any interventions, any medications.
All right, give me another roll. Another roll? Another roll. Another roll, come back out.
And then after that, you will have people on each side, designated spots of the body, left upper hemisphere, left lower hemisphere, that type of thing. Overall, it just creates for a better teamwork environment.
You got what looks like a laceration abrasion on the left hip.
Yes.
Left hip front.
Hey,
And then another laceration left thigh.
Students will spend around 4 hours treating each patient using techniques and procedures they learned during the first phase of their training. They get an introduction to emergency medicine early on in training as part of becoming EMT certified.
Challenges that students face in this portion of student training is a fire hose of information tasked with skills that they're performing for the first time. So that high stakes testing and situation that they're in really provides them with a very good backbone for the future of their medical careers.
And one swift motion, a stab till you hear the click. One.
They throw a lot at you, so it's a lot of memorization and just being able to think critically and think quickly and be effective.
Sir, please go ahead and stop chest compressions. We'll go ahead and assess carotid pulse and breathing.
It all leads up to the NREMT exam, a 2-part certification process that all students must complete before moving on with their training.
It represents a national standard of excellence, and we ask the same thing for our healthcare providers, our doctors, our nurses. All of them have to meet national standards and board certification, and we require our medics to have that same standard.
And you are going to inflate the balloon, all 10 milliliters of air. The injuries that we're teaching them to treat would be anything that interferes with the movement of air in and out of the body. Whether that be that they inhaled superheated air or they have some sort of maxillofacial trauma, we teach them to mitigate or even bypass that oropharynx so that air can still move into the lungs.
2005. Ventilate.
During the field training exercise, students need to know several procedures for treating injuries to a patient's airway.
Oh, man!
And one of the more complicated procedures future combat medics learn is how to perform the cricothyrotomy, which might be required if a soldier sustains an injury to the face or lungs.
Scalpel.
Sharps!
Students first practice performing a cricothyrotomy on a mannequin before moving on to real tissue in the form of a pig trachea.
All right, we're gonna put it, nope, you want it to go in this way, right? Because we're trying to go this way.
I really enjoyed the pig because it was like an actual, trachea and stuff. So I got to feel how a real one, like the anatomy feels.
Feel that roll into the trachea. You're trying to push down. Don't push down because that's why you're not getting air.
What we're doing right now is just giving them tools and skills, and then later on when they do their field training exercise, they will actually have them start thinking outside of the box. What kind of things do you do when you don't have that surgical cric? How are you going to maintain that airway and get that oxygenation level back up?
And he's going to keep rocking that bag.
One of the final procedures students learn in training is also one of the newest additions to the program: how to perform an autologous blood transfusion.
A situation a student may find themselves in an operational setting where they might need to administer fresh whole blood is a patient that's hemorrhaging and has lost a significant portion of blood and is in hypovolemic shock or hemorrhagic shock. And what we're going to do is we're going to return that blood product back into them, preferably fresh whole blood, in order to get return of radial pulses and get them into a normotensive status.
So I'm going to go right here, and we go right here.
After several lectures, the students observe an instructor demonstration before practicing on a training simulator.
So I think initially they definitely have some butterflies, but once they see the instructors do it, you see the arms behind us, they get to practice on the arms before they practice on a live patient. I think that kind of fades away, and I think they're excited.
Finally, the students practice performing the procedure on each other.
It was nerve-wracking. I was doing it on a friend of mine, and I just kept thinking, man, it'd be really awkward if I did something wrong. I mean, how did you talk about that, bring that up afterwards? Like, hey, I'm totally sorry, I forgot to tie off the blood bag, but it's cool.
In my head, I was just like, please don't kill her, please don't kill her. I was just trying to make sure, like, I got everything precise. At the end of the day, I got it, didn't lose any extra blood. She was fine, and it went well.
When you're doing blood transfusions, you have to make sure that you're watching their vitals. You have to continuously stay on top of it. There's a lot of moving parts to it that need to be done simultaneously and continuously.
Did you ever think you'd be capable of performing a blood transfusion?
No, not at all. Especially when I was doing it, I was like, I kept thinking of everything I could possibly do to do it wrong. I'm like, maybe I'll do this and this will be wrong. So I never thought I'd be capable of doing it, but once I did, just kind of smooth sailing from there.
As soon as he plugs that in, okay, go.
In the culminating field training exercise, students don't know which of the procedures they'll have to use, which is why they have to be prepared for all the ones they've learned in training.
There's an expectation that they're going to stumble a bit, but as long as we can watch that group and watch them kind of think through the problem and start looking around their setting and being like, what other tools do I have available that I can use to help this patient along? And if I don't have exactly what I need, what can I do to kind of make that happen?
Need a 10cc flush. When did you throw that tourniquet on?
Tourniquet was on probably 5 minutes ago. For me, it literally just draws me in. I'm focused on what I need to do. What's going on right there in front of me is what needs to be done. So for me, I'm at home.
In my opinion, they view this as the best part of their training. They actually get to see what they've learned in the classroom actually get put into action.
I feel really accomplished. It's been hard, but it's been really rewarding too. It's just crazy to think that I made it this far, and I'm proud of myself. I'm proud of all my battle buddies, and we're all doing really well.
After surviving the field training exercise, the students depart from Camp Bullis with a 4-mile ruck march at sunrise, symbolizing the end of their training. Most of the graduates will return to their home station, either in the National Guard or the Army Reserve. The rest will be assigned to their next post in the active duty force.
When you look at the future operating environment and what that beholds with near-peer adversaries and a higher op-tempo environment, an environment that will require prolonged field care in some cases, Army medics, the training that is conducted with them is far greater and more impactful than it ever has been.
Life is finite, and you don't always know if you're guaranteed tomorrow. You may go out on a patrol one day, nothing happened. You go on a patrol the next day, you're getting shot at, you're taking casualties, and your battle buddy's relying on you. And no matter what, you're going to do what you can to get your battle buddy home.